Well, good morning, everyone, and it's a pleasure to be here. And I want to thank Peter and the Planning Committee for putting together this panel. And I hope we really do have time for a discussion. So I just want to make a couple of comments, blow through some slides, and then we'll all duck and see what happens after you respond to our comments. So let me pick up on something where my colleague Melinda Abrams, Melinda, where are you? She must be here somewhere, started with. You know, for us, I think this notion of function is a real driver. These folks are all high cost, high needs individuals, and they don't look like it. All right, I just want to start to challenge our conception of what a high cost, high need individual looks like. So I think this notion of focusing on function as a key driver, that there's a preponderance of evidence standard that we need to focus on. I love elegantly designed studies. I'm a general internist by training, academic, dilettante health services researcher by background. And so I just think when you look at real systems, we've got to use the data we have available and build the system we know we all want and be rigorous about how we get there. I think this notion of not focusing on patients, starting to focus on people is really important. So for all of you people who work in medical systems, you are the problem. And people are only patients when they're in your bed or in your doctor's office, generally in the waiting room waiting to be seen, sort of looking at the magazines. That's a problem. And until we start to see, and I think about the presentation where it talked about, you know, what is it you're trying to achieve? That sort of question, goal setting that is functionally driven is incredibly important. And finally, we just need to stop looking under the lamppost. And so maybe this is my most provocative comment for the day before I blow through these slides, is, you know, we can look at the MEPS data and we can look at this Medicare data set and that Medicaid data set till the cows come home. Till the cows come home. And we're not actually going to see the person in that data. You're not going to actually capture function. So we need to stop, I mean, we need to develop a good baseline, but we need to get serious about measuring the things that count and ultimately tying payment and outcomes, how we judge outcomes to those standards. So to make the slides go, so now I'm going to go fast. Picking up on where Melinda left off. So when you look at the 97 million Americans living with chronic conditions, you know, roughly half have some activity of daily activity of limitation issue that is important to them. And that says something about how we need to focus. Again, a slide kind of similar to what Melinda brought up. This is old data, but current data looks exactly the same. So when you look at chronic conditions as opposed to chronic conditions with functional limitations, it is far more expensive using Medicare data to care for somebody with functional limitations on top of chronic illnesses. So here's the take home from this slide for me as an internist. It is not about people's problem list. It is not about people's problem list. Did I say it's not about people's problem list? And this sort of medical system notion, if we could just elicit all of somebody's problems, and then we sort of put them all together, like what's wrong with disease management is this notion of, well, you know, if we just chased one disease, we missed all their other diseases. So if we just kind of be, you know, broader thinking about people's diseases, we'll get there. That will not work. So, I mean, if there's one take home from this presentation, that's it. We're going to need to better understand function. And I think Jeremy really articulated many of those issues in his experience. And I'd offer you today, we don't measure 99% of what he spoke about. We don't value it. We don't reward it. It's not part of outcomes measurement. So if we're going to start to see patients as people as opposed to people as patients, we're going to have to get there. 4 sources of high cost variation: medical, social support, behavioral, and the physical environment. To not think about all of them in these very diverse populations we're talking about is a failure to address all sources of variation. This is how the medical system sees variation today. If we could just manage your chronic diseases better and maybe have like fancy discharge planning and maybe a little bit of cognitive support will all be good. That is not it, people. We're going to have to get way more serious about what it means to help people thrive in community. Function resides in the center. It's all these things, right? And until we get serious about, and I'm not saying the medical system has to necessarily pay for every single one of these, but until we take kind of a whole person view, we're going to miss the opportunity. People are at the center of this, not the other way around. So the notion of a whole person assessment, responsive care coordination, and then relationships across provider platforms. Those are medical platforms, those are community-based support platforms, those are behavioral health platforms, those are physical environment platforms. So, as we think about that martini that will greet all of us at the end of the day, the kind of, the missing piece in all this really is function. So going back to my earlier point, getting a core data foundation is key. But if you think we're going to get a robust look at function in the current data sets that Medicare and Medicaid collect, we're not. And I think nothing drove me nuts more than to watch MedPAC say, oh yeah, we went back and looked at function again, it doesn't make any difference. Well, it's only, we'd rather include another year of data and we'll get there. That just fails to recognize our inability to manage the things that count, and we're going to need to do that to get to the kind of outcomes and performance measures and value that we're trying to create. That's it. Those are my challenging comments. We'll see where it takes us.